Histology: cell membrane or plasma lemma. Galt is present in lamina propria. Chief cells are found in fundus. Collecting ducts are lined by urothelium. Stereocilia are seen in epididymis. Clara cells are found in branchioles. Ceruminous glands present in ear or modified apocrine glands. Cartilage of epiglottis is elastic. Brain, internal ear and eye have no lymphatics. Correct sequence of cell cycle is G0, G1, S, G2, M. Bar body is found in interface of cell cycle. Type 1 collagen is present in skin. Thyroid follicles are lined by simple cuboidal epithelium. Preganglionic autonomic axons from Edinger-Westphal nucleus travel via nerve to inferior oblique to ciliary ganglion. Wallenberg syndrome is caused due to obstruction of pica. Ipsilateral loss of temperature is not seen in Brown-Sequard syndrome. Broca's area is present in inferior frontal gyri of brain. Tumor which does not occur in anterior mediastinum is neurogenic tumor. The nerve associated with pharyngeal cleft is derived from neural crest cells. Umbilical cord has a special connective tissue called Wharton's jelly. Derivatives of dorsal mesentery are greater omentum, gastrophrenic ligament, gastrosplenic splenorenal ligament. First heartbeat in a fetus occurs at 21 to 22 days. Anterior layer of thoracolumbar fascia covers the anterior surface of quadratus lumborum. Quadratus lumborum lies between anterior and middle layer of thoracolumbar fascia. Epithelium lining hard palate is keratinized stratified squamous epithelium. Aortic opening of diaphragm gives passage to aorta, thoracic duct and azygous vein. 7th and 8th ribs are attached to each other by synovial joint. Iliolumbar ligament is continuous above with anterior and middle layer of thoracolumbar fascia. Simpson's fascia is an extension of scalenus minimus. Special visceral efferent does not include dorsal nucleus of 10th nerve. Lacrimation is lost in lesion of greater petrosal nerve. Venous drainage of esophagus is by azygous vein, inferior thyroid vein and left gastric vein. Most important blood supply to the stomach is left gastric artery. Type 1 collagen is not present in cartilage. Compartment of leg without neurovascular bundle is superficial posterior compartment. Spinal cord ends at level of L1 in adults. Inferior thyroid artery is a branch of thyrocervical trunk. Proprioception sensation is not perceived by spinal nucleus of trigeminal nerve. Purkinje fibers relay into dentate nucleus. Preganglionic fibers from lower thoracic and lumbar vertebra comes via sympathetic chain to supply adrenals. Mandibular foramina transmits inferior alveolar nerve and vessels. Submandibular gland is supplied by lingual nerve. In Frey syndrome, the nerve involved in trigeminal nerve is auriculotemporal nerve. Right coronary artery takes origins from right aortic sinus. Anterior belly of digastric is derived from first pharyngeal arch. Dermatome of umbilicus is T10. Internal capsule is a type of projection fibers. Uvula vesicae is due to median lobe of prostate. Derivatives of external oblique aponeurosis are inguinal ligament, lacunar ligament, pectineal ligament. Left posterior second intercostal vein drains into left brachiocephalic vein. Muscles which causes inversion of foot are tibialis anterior, tibialis posterior. Muscles which cause aversion of foot are peroneus longus, peroneus brevis. Ligamentum flavum consists of elastin. Temporalis muscle elevates the mandible, so shuts the mouth and approximates the teeth. Ophthalmic artery is not a branch of external carotid artery. Ulna is not involved in formation of wrist joint. Level 6 lymph node extends from hyoid to clavicle. Golgi apparatus in serous SNR cell is at supranuclear position. Thyroid gland receives its blood supply from inferior thyroid artery, which takes origin from subclavian artery. Paracentral lobule is responsible for control of defecation and urination. Syphilis patient walks with closed eyes and stamps hard on the ground. The tract affected is dorsal column tract. Fibers arising from inferior olivary nucleus reach Purkinje cells directly. Lordosis is normally seen in lumbar spine. The structure that divides the liver anatomically based on Coinard's classification system is portal vein. After parotidectomy, patient complain of loss of sensation while shaving. The nerve most likely affected is great auricular nerve. Middle finger has attachment of two dorsal interossei muscle. Duct of Bellini are present in kidney. Skin or anatomical snuff box is supplied by radial nerve. Joint involved in movement of head from left to right is atlantoaxial joint. Boundary of Kellogg's triangle is formed by common hepatic duct, cystic artery and cystic duct. Contralateral loss of pain and temperature is due to injury to lateral spinothalamic tract. Foot drop is due to injury of peroneal nerve. Kiter cells are modified macrophages in CNS. Space of disease found in liver. Cholecystic caval line separates right and left liver lobe. Branches of anterior division of internal iliac artery include inferior gluteal, superior and inferior vesicle, middle rectal and vaginal arteries. Deep inguinal ring, just above the midpoint of inguinal ligament. Superficial inguinal ring, just above and lateral to pubic tubercle. Gastrosplenic ligament connects the hilum of spleen to stomach. Greater curvature and contains short gastric vessels associated with lymphatics and sympathetic trunk. Lenorenal ligament connects spleen to left kidney and contains tail of pancreas, splenic vessels, pancreatic splenic lymph nodes, lymphatics and sympathetic nerves. Phrenicocholic ligament is not attached to spleen but supports its anterior end and prevents its downward displacement in splenomegaly. Most common location of accessory spleen is hilum of spleen. Spleen contains about 2% of total blood volume. Lordaceous spleen is due to deposition of amyloid in sinusoids of red pulp. Sural nerve lies close and lateral to SSV throughout its length. Supplies the skin of lower half of posterior surface of leg, lateral part of dorsum of foot and is at risk during dissection of saphenopopliteal junction. The common peroneal nerve is particularly at risk during multiple stab avulsions as it winds around the neck of fibula, tibial nerve and vessels behind the medial malleolus and saphenous nerve in medial cuff. Nerve roots of cranial nerves 9, 10 exit the medulla through the jugular foramen and descends on either side of pharynx to finally innervate the posterior pharynx, posterior 1/3 of tongue and soft palate and stylopharyngeus muscle. Contraction of pharyngeal musculature ipsilateral to the side of stimulus is known as direct gag reflex and contraction of musculature on contralateral side is known as consensual gag reflex. Damage to musculocutaneous nerve can result in problems with the tissues in innervates include loss of sensation in the skin on front side of forearm, weakened flexion at shoulder and elbow, weakened rotation of arm. Musculocutaneous nerve is the terminal branch of lateral cord of brachial plexus. Isolated injury of musculocutaneous nerve is rare as it is well protected in axilla and elsewhere along its course through arm, and musculocutaneous nerve dysfunction is caused by injury to brachial plexus which contains numerous nerves. External carotid artery supplies the nose via facial and internal mammary branches. The superior labial branch of facial artery supplies the anterior nasal floor and nasal septum. Taste buds contain epithelially derived taste receptor cells, sustentacular cells that surround a small central cavity that opens on surface as tiny taste pore. Foliate papilla of tongue appears as bilaterally paired parallel longitudinal slits on posterolateral margin of tongue near the sulcus terminalis. Circumvallate papillae. There are only about 10 to 14 of these papillae on most people and they are present at the back of oral part of tongue. They are arranged in circular shaped row just in front of sulcus terminalis of tongue. They are associated with ducts of von Ebner's glands and are innervated by glossopharyngeal nerve. Umbilical arteries supply deoxygenated blood from fetus to placenta. Umbilical vein is a vein present during fetal development that carries oxygenated blood from placenta into growing fetus. Association fibers serve to connect regions of grey matter reciprocally, establishing spatially defined networks that determine function. Short association fibers may be entirely intracortical, passing between walls of sulcus. They may pass subcortically between adjacent gyri and connects clusters of cortical areas subserving similar functions. Example, in frontal lobe, short intralobar tracts connect the supplementary motor area and pre-supplementary motor area with posterior Broca's region, frontal Aslan tract. Posterior orbitofrontal cortex with anterior polar region, fronto-orbitopolar tract, and posterior precentral cortex with anterior prefrontal cortex. Fasciculi, bundles, tracts of long association fibers connect anatomically distant yet functionally highly integrated areas of ipsilateral cortex. Hippocampal commissure or commissure of fornix is a thin triangular sheet of fibers that lies between crura fornices connecting the hippocampi, is situated underneath, attached to the splenium, overhanging of pineal region. Fornix has association and commissural fibers. Resident cells of liver include hepatocytes, hepatic stellate cells, fat storing the cells, sinusoidal endothelial cells, macrophages, Kupffer cells, and the epithelial cells of biliary tree, cholangiocytes, hepatic stem cells, natural killer lymphocytes, connective tissue cells of capsule and portal tracts. Hepatic stellate cells are much less numerous than hepatocytes, irregular in outline, and lie within the perisinusoidal space of Dissay between sinusoids and hepatocyte plates. Mesenchymal in origin and are characterized by numerous medulla oblongata. Inferior cerebellar peduncle is formed on posterolateral aspect of upper half of medulla oblongata and contains mainly of afferent fibers to the cerebellum from spinal cord, olivary nuclei, and reticular formation of medulla, and the vestibular nuclei and nerve. Middle cerebellar peduncle is the largest of three peduncles. It is formed at posterolateral margin of pons and consists of only afferent fibers which arises from pontine nuclei of opposite side. The superior cerebellar peduncle emerges from the anterior cerebellar notch and forms the lateral boundary of upper half of fourth ventricle and is the principal efferent pathway from cerebellum, and its fibers arise mainly in dentate nucleus. Fibers of fasciculus gracilis and fasciculus cuneatus terminate in nucleus gracilis and nucleus cuneatus respectively. The axons of second order sensory neurons from nucleus gracilis and nucleus cuneatus curve ventromedially around the central grey matter of medulla, and internal arcuate fibers to undergo decussation turns upward after crossing the midline as a flat tract called medial lemniscus, which curves upwards to terminate in ventral posterolateral nucleus of thalamus. The action of gluteus maximus is extension and lateral rotation. It is the tensor of fascia lata, and through iliotibial tract it stabilizes the femur on tibia when extensor muscles of the knee are relaxed. The region in anterior part of temporal fossa where four bones, frontal, parietal, squamous temporal and greater wing of sphenoid meet to form a H-shaped suture is called tirion. It is situated 4 cm above the midpoint of zygomatic arch. The tirion overlies the anterior division of middle meningeal artery, which ruptures following a blow in the region to form extradural hematoma. Saliva formed after autonomic stimulation and contains electrolytes and carbohydrate digestive enzyme salivary amylase and antibodies produced by connective tissue plasma cells and lysosome to control oral bacteria. Exocrine pancreas forms majority of organ and is composed of serous acini containing pale staining central acinar cells in their lumina, which are continuous with cells of intercalated disc. Secretin stimulates sodium bicarbonate production by centroacinar cells and intercalated duct cells. Parotid gland has striated and intercalated intralobular ducts where the pancreas is the only intercalated type. Excretory ducts of parotid gland are striated or stratified columnar, whereas excretory duct of pancreas is simple columnar. Excretory ducts of parotid gland are stratified columnar, where the excretory duct of pancreas is simple columnar. Divergence allow one neuron to communicate with many other neurons in a network, while convergence allow a neuron to receive input from many neurons in a network. Internal capsule is divided into the following 5 parts: anterior limb, posterior limb, genu, retrolentiform part, sublentiform part. Anterior limb, posterior limb, retrolentiform part, sublentiform part, genu. Posterior limb has motor fibers from upper limb, lower limb and trunk through the corticospinal tract, which crosses at medulla, and thus infarct of artery supplying the posterior limb will cause contralateral hemiplegia. Carpal tunnel compression test or Durkheim's test is the most sensitive test to diagnose carpal tunnel syndrome. Static and moving 2-point discrimination measures multiple overlapping of different sensory units and complex cortical integration, and is a good measure for assessing functional nerve regeneration after nerve repair. Pretracheal fascia prevents upward extension of thyroid swelling, encloses and suspends the thyroid gland and forms its false capsule. The posterior layer of thyroid capsule forms ligament of Berry. Levator scapulae muscle is supplied by branch from dorsal scapular nerve. Levator scapulae helps in elevation of scapula and steadies the scapula during movements of arm. Plain synovial joint permit gliding movements in various directions. Examples include intercarpal joints, intertarsal joints, joints between articular process of vertebrae, cricothyroid joint, cricoarytenoid joint. Meiosis occurs in gonads during gametogenesis. In testis, meiosis does not occur before puberty. The recurrent laryngeal nerve branch off the vagus and left at aortic arch and right at right subclavian artery. The left recurrent laryngeal nerve is longer than its counterpart due to its persistence of fourth arch artery. Interosseous and lumbricals flex metacarpophalangeal joints and extends interphalangeal joints, and injury to interosseous and lumbricals lead to claw hand, extended metacarpophalangeal joint and flexed interphalangeal joint. Right gastric artery arises from common hepatic artery, while right gastroepiploic artery arises from gastroduodenal artery, which is a branch of common hepatic artery, and thus ligation of common hepatic artery will lead to impaired blood supply in right gastric artery and right gastroepiploic artery. Left gastric artery arises from celiac trunk. Cartilage, a vascular structure, has much longer healing process and time when compared to healing time of bones. Hyaline cartilage is the most common cartilage and is found on ribs, nose, larynx, trachea, and is the precursor to a bone. Fibrocartilage is the strongest cartilage and is found in the intervertebral discs, joint capsule, ligaments. Elastic cartilage provides strength and shape maintenance and can be found in external ear, epiglottis, larynx. Neuroenteric ganglion cells migrate from neural crest to upper end of alimentary tract and then follow the vagal fibers caudally. Delay or arrest in migration result in neural crest cells failing to reach the distal bowel and thus causing Hirschsprung disease. Hypopharynx starts at level of hyoid bone. 3 unpaired cartilages of larynx are epiglottis, thyroid, cricoid. 3 paired cartilages of larynx are arytenoid, corniculate, cuneiform. Optic nerve does not cause movement of eyeball. Paradoxical respiration occurs due to damage of phrenic nerve. Reticular connective tissue is a type of connective tissue with network of reticular fibers made of type 3 collagen and is found around the kidney, liver, spleen and lymph nodes, pairs patches as well as in bone marrow. Adipose tissue is held together by reticular fibers. Epididymis is lined by pseudostratified columnar epithelium with stereocilia. Middle radioulnar joint is a type of fibrous joint also known as syndesmosis. Actions of hip joint: thigh extension, thigh external rotation and assist in rising from sitting position. The lower border of lung extends till 6th rib in midclavicular line, 8th rib in mid-axillary line, 10th rib in mid-scapular line. During quiet breathing, the diaphragm moves about 1.5 cm. During deep breathing, it moves by 6 to 10 cm, thus extending up to level of 6th rib and 11th thoracic vertebra on right side. On full expiration, diaphragm extends up to 4th costal cartilage anteriorly, posteriorly up to 8th vertebra. The diaphragm on left side is generally lower than right side. Abductor pollicis longus is inserted on side of base. The first palm or interossei muscle arises from ulnar side of base. Some miscellaneous points. Pinna develops from first and second pharyngeal arch. Eustachian tube develops from first pharyngeal pouch. Earasicles attain adult size before birth. Myoblast of diaphragm develop from somites. Facial skeleton develop from neural crest. A midline cleft lip is due to failure of fusion between medial nasal process. Supernumerary renal artery. Supernumerary renal artery is the most common renal vascular anomaly. Y chromosome is acrocentric. A person showing two cell lines derived from two different zygotes is known as mosaicism. Bower body appears in female fetus at 10 weeks. Right isomerism is asplenia. Melanoblast cells appear in basal layer of epidermis during 3rd month of intrauterine life. Umbilical vesicle attain full development in 4th week. If there is absence of precursor cell of an organ with subsequent non-development of organ, the condition is known as agenesis. If there is absence of precursor cell of an organ with subsequent non-development of organ, the condition is agenesis. Spinal cord develops from neural tubule. Myelination is completed by 2 years of age. Retina is an outgrowth of diencephalon. First commissure to develop is the anterior commissure. This completes the bullet points of anatomy. We will revise once again afterwards, but for now, this is the conclusion. See you with next vlog, physiology.